Moving on, Mr. Edem Senanu, board chair of Advocates for Christ Ghana, has opposed arguments propounded by LGBTQIA proponents that their sexual behavior and orientation have their basis in genetics. His stance hinged on the largest study on the genetics basis of sexuality conducted in 2019, in which investigations were carried on the genomes of 500 million people. Mr. Senanu made the comments on Friday during a presentation on a medical, genetics, and psychological memo on the promotion of proper human sexual rights and Ghanaian Family Values Bill 2021 in Accra.
And there's child sex abuse. The research also shows that most of them experience sex abuse. And that's what has made them who they are in childhood. And then they repeat same. You see, where the Genome Project said that 75% of what contributes to your sexual orientation is based on your environment and culture. So if in your environment you were sexually abused, your sexual orientation towards your children will emanate from what happened to you. Are you with me? So that's the logic in the science. So the science has shown that for most homosexuals, they are likely to replicate and visit the same type of experiences they've gone through on their children, on young people in their environment. Let's look at the data. The ratio of physicians per 1,000 people in Ghana at the moment is 0.1. Number of physicians per 1,000 people is 0.1. Compared to 2.6 physicians per 1,000 people in the UK and 2.8 physicians per 1,000 people in the US, you have 0.1. We also have a low overall national hospital bed capacity. Our total bed capacity is 0.9 bed. We haven't got one bed. 0.9 bed per 1,000 people. In the UK, it's 2.5 beds per 1,000 people. And in the US, 2.9. You have 0.9. The medical and psychological impact is grave. It's affecting everything, including the medical systems in the countries where they are promoting this and allowing it. In those countries, medical doctors are not allowed to engage their patients, diagnose, and treat them in a manner consistent with their expertise. They are forced to embrace this inclusion ideology. So for social reasons, let's just accept everybody. Let's all be quiet and allow it. Let's not tell them that this is just anxiety. This is just depression. No, don't tell them. Just tell them you are okay. The mandate being pushed by the current US government in this area is being challenged by the Alliance Defending Freedom on behalf of the American College of Pediatricians, as well as the Catholic Medical Association and other individuals. So this thing that is going on, for example, in the US, is being challenged. The gender inclusion package is holistically dangerous. Let me say that. It's holistically dangerous. I want to say we are embracing everything. If embraced by Ghana, our nation will slowly arrive at the levels of chaos that we can see, or anarchy, in other healthcare systems. Our healthcare system already needs a boost. We must learn our lessons from the other jurisdictions that this is being practiced and make sure that we protect our populace. Contrary to the views expressed by the LGBTQI persons, proponents, assigns, agents, and what have you, sex is binary, and it is scientifically assigned at birth by the presence of male or female genitalia, but not just that, by the issue of your chromosomal composition and your hormonal levels. All of that forms a basis of deriving and arriving at who you are, whether male or female, not just a physical observation of whether you have a male organ or a female organ. After studying 500 million citizens of the earth, the largest single ever research work the Human Genome Project has established, there is no evidence of any gay gene.